Okay, so this week's topic was living with lung cancer and some of the issues faced with that, and watching the video and responding about that topic. So, some of the issues that individuals diagnosed with lung cancer can face, like you're going to have difficulty breathing, obviously, um, which can ultimately affect your heart by applying pressure to the heart due to the fluid buildup in the lungs. Um, and then, according to lung cancer, like early symptoms, early signs in your early stages, there's no definite signs or symptoms involved with that until you get to later stages. And then you have like a persistent cough, wheezing upon breathing, and then sometimes some chest pain involved with that. Um, your prognosis with lung cancer is not very good. What I read online was only 4% of people diagnosed with stage 4 lung cancer are expected to see the 5-year mark after they've been diagnosed. So it's not very good. You really want to catch things early with that so you can get treatment started. And as far as treatment goes, there was some things discussed in the video. Um, Normally nowadays you have chemotherapy mixed with radiation for the most part. Determining whether or not, like, if you have later stage advanced lung cancer that's localized, considering that it hasn't spread, um, you can do a lobectomy and remove that part of the lung. It used to be a very invasive procedure where they would literally like crack your chest and take out whatever portion of the lobe of the lung or a whole lung or however they needed to go about doing that or how much they needed to take from doing that. And then, like, after watching the video, the doctor discovered that he would like to find a less invasive procedure to removing part of the lung. So he went on and did a lot of education and found out resources to help him with that, and actually figured out a way to do a lobectomy where you can go through one port or hole and do use your instruments and removal and things of that nature. So it's a lot less invasive. The recovery time for those patients is a lot better. So, like, I believe the guy on the video said he was up and walking and doing things the next day, and your recovery time's a lot quicker with that. Um, where you can get back to a normal life. A lot of times you're only in the hospital less than 24 hours with that type of procedure and able to get on with other things. But even with the lobectomy, you're probably looking at side treatment of chemotherapy and radiation involved with it, also. Thanks.